Jennifer Eickstadt. I've been a PA since 2010. I graduated Spokane class 12. I work currently in Newport Family Health. I've been here for about 3 years. We're a family practice, so everything from babies to the elderly and everything in between. I personally do a lot of women's health, a lot of teenage adolescent medicine. And I also am the jail provider for the county. So 1 day a week I get to go to the jail and see those patients. I was 19 years a medical assistant for a family practice in Spokane. I worked with basically the same doctor for most of those 19 years. And he and I worked really closely together, and he taught me pretty substantial amount of things for family practice. And just kind of after 19 years, I thought I'm ready to do something else with my career. I had worked with PAs in our family practice and kind of shadowed them and followed them. So I really like my job. I love patient care. I really love getting to know these families, and they come back to me, the grandparents, the children, and sometimes those kids are now having their own kids. It's kind of fun to know the stories of the families. And then I can really kind of know where they're coming from when they come in with, different problems. Precepting is a little bit extra work, but I do enjoy, I feel like I've had these years of knowledge, and it's fun to share. And, I'm always learning as well. So it forces me to be a continual learner, so I can share with my students. And it wasn't that long ago that I was a student, and I know how hard it is to find preceptors. So I am the jail provider for Pend Oreille County, and I think students don't always realize that on Tuesday mornings I go to the jail. So I think at first when they come up, they're a little shocked when I say, okay, tomorrow we go to the jail to see patients. And was that a little bit scary for you?
Yeah.
Or how did you feel about that?
It was, I was scared about everything because it was still the first week, but it was definitely intimidating, I would say, especially just because I told you this, I grew up in private schools and very affluent, wealthy communities, I guess. And so for me, it was a great experience, and still is a great experience, to go and see healthcare provided to kind of an underserved population. And it's been really a very valuable experience for me, I would say, in my clinical year. I mean, I got the opportunity to see things there that I probably wouldn't have seen in the clinic, such as people going through drug withdrawals and things like that, and doing a lot of mental health provision and care.
There's a lot of behavioral medicine that we do here. I would say even 50% of what we do, at least, and by about 90% at the jail is mental health. Anxiety, depression, remorse, a lot of drug withdrawal. There is ample drug use within our community, as well as in a very rural community. I've been, even in Idaho, there was just as much there as well, unfortunately. And somewhat in family practice as well. We do have some providers that treat with Suboxone, so we do, a couple providers that do that treatment as well. So it is a problem. It is a problem everywhere.
What kind of drugs are you seeing?
A lot of heroin, a lot of meth, and a lot of heroin.
And is the heroin use coming off of the use of opioids, or?
Hard to know.
Hard to know, yeah. Opiates are really, pill form are really a lot harder to get these days, of course, with the new regulations. So I don't find that in family practice there's not as many people coming in asking for those, or as many chronic pain patients. I think they kind of have got the word, so I almost feel that they've gone more to heroin because they can't get as many pills. And I don't have statistics. I mean, that could be wrong, but that's kind of how I see it. And heroin withdrawal is not pretty.
And you see that here in the jail?
See it at the jail, yeah.